I'm going to try to make this quick, y'all. Whether you know it or not, all insurance is based on risk. Insurance company rates are based on how far out they can spread the risk. Whatever insurance you're getting, be it healthcare, auto, life, as a group, you tend to get better rates because they can spread their coverage risk, their risk of having to pay out on the policy across the group. Real simple. You got car insurance, you live in an area where they tend to break in cars, your rate's going to be higher than somewhere where they don't tend to break in cars. Health insurance. The main thing about the ACA was the government said, hey, private insurers, because there's all private insurers in the marketplace. There is no government/public option. But it allowed different regions, area codes, or what have you, to be able to get group rates based on, I guess you would say, the payout experience of that area. Well, I'm going to just summarize it like that. I could put enough people that's going to pay and not use it and combine them with a number of people that are going to pay and have to use it, and the rates spread out. When you get rid of the people that don't really use it but are paying, your rates go up because most of you that are left have to use it. That's just private insurance, period. No one has them under control. No one. They're private entities. So unless you can come up with a public option, which it hasn't been done, Republicans for 15 years have been peeling away at the Affordable Care Act, causing the rates to go up. After COVID, Biden did raise the income or salary minimums, meaning people who earned a little bit more could get in because there was a gap. They were left out. They weren't able to participate in getting group rates because they were left by themselves. So my understanding is those are the main things that the Republicans were, that's the main subsidies that were going. Subsidies, why you have to subsidize it? Your employer health care is subsidized. They pay a piece, you pay a piece. And if you've noticed, your employer's trying to pay less even now. So, whatever. Personally, you say some of my tax money can go to help other people afford to buy insurance, especially those with pre-existing conditions. And believe me, right now, they could use chickenpox as a pre-existing condition. I'd rather that than $40 billion to Argentina because I'm never going. I'm just saying. Why am I paying taxes in America if I can't get services in America? That's supposed to be the give and take of taxes, just in general. Roads, security, property protection, like I own it. I can go to a court of law and get rid of people trying to, you can't just steal my property or not supposed to be. So it's supposed to be on health care. Real simple. The number of people that won't be able to afford their health care without those subsidies is going to make the rolls fewer. This is after Trump's last term where they successfully removed the mandate, meaning the younger people who would pay and not use the insurance, which are the people, that group helps the other group and helps the whole package have a different type of premium curve. So they removed them successfully Trump's last term from it. They removed the mandate to younger people who don't have to use it, or places where your car doesn't get broken into, they don't have to buy insurance. I'm just doing this parallel for you. So rates went up. But if you take 10 million people off the insurance rolls because of affordability, I don't care where you get your insurance from, because you're all being insured through the same companies. So if you get it through your job, maybe your rates don't go up this year. Or maybe you don't feel it as much because your company takes it on a little bit. You understand what I'm saying? But you'll see this in the next 1 to 2 years. And I'm just saying, that insurance boat is a boat that either lifts us all or definitely will drown us all. I'm going to leave it at that because it's going to get kind of long. I'll try to do another one. I'm speaking in general. Insurance license over 15 years. Medicaid, certified specialist. Medicaid and Medicare. Let's just go there. I used to call people, enroll them, go over the plans and enroll them in the plans through the Affordable Care Act. Also, the company I worked for at the time, I watched, because a lot of older companies had retirees on their healthcare plans. In order to save costs, they turned it so that they would give those retirees a annual stipend. Here, we'll cover this much. You go to the Affordable Care Act marketplace, get you some insurance, and pay the rest out your pocket with whatever other assistance you can get. I'll leave it at that. I think I need to go into the little bit I know about Medicaid, the state-run programs, and the money that comes from the Fed for that, and how that's going to change lives. Mr. Taylor out.